Hi, I'm Dr. Jim.
And I'm Dr. Janine.
And we are Doctor's Nutrition.
Today, we're going to talk about something that a lot of women have a problem with.
Over the years, we've seen thousands.
Yes. And it is, do you know what fibrocystic breast disease is? A lot of men watching might not, but you might have a wife that has it. And it is when there's little cysts in the breast that are very, very painful.
Very painful.
Yeah, and it's a very common problem. We see a lot of it. And a lot of people don't even mention it as a health issue because they think, oh, okay, everybody has it. And it is very common. But we're here today to tell you there is something that you can do to help it and get rid of it.
Yeah, because like she said, over the years, we've seen literally thousands of these females with all these problems. And some of them will tell you that it hurts so bad, they can't even put a bra on.
Yeah.
Or don't want anything touching them at all.
They definitely can't lay on their stomach or anything like that because it is very uncomfortable. So there's two things that we're going to tell you today. And there's a third thing that you can add that you definitely want to do if you have fibrocystic breast disease. Now, one, everybody knows too much caffeine makes it worse. So stay away from the caffeine. Don't overdo it because that does worsen the fibrocyst. But the things that we use, one is called primrose oil. Primrose oil has GLA, gamma-linolenic acid. Really, really good for fibrocystic breast disease. Extremely. Now, you do have to take enough of it because in primrose oil, a lot of the capsules you'll see are only 500 milligrams. Ours are 1,300 milligrams. And we use at least 2 a day, so at least 2,600 milligrams. And sometimes we go to 3 a day if somebody's is really severe. So on the primrose, it is very important to take enough of it. And always take your primrose oil away from your omega-3s. And really the reason is because they compete. And you don't want, if you're going to spend the money on taking things, you want it to be able to absorb and you don't want it to compete with something else. So if you take your omega-3s in the morning, take your primrose oil at night. I take it at bedtime myself because it also helps hot flashes in those postmenopausal women.
Yeah, and that's worthwhile, guys. Believe me.
Yeah.
Okay. No, that's worthwhile. Yeah, the other thing that we use along with that, these are our two go-tos. The primrose, some people call it evening primrose oil, but primrose oil. And the other thing is iodine. And there's some really good research on iodine and how iodine actually helps protect the breast tissue from things like breast cancer. There's some great research out there on that.
Yeah, they've actually shown that the breast has a lot of receptors like the thyroid. People always think of iodine for the thyroid, but they've never thought about it for the breast. But actually, iodine can even help with breast cancer prevention. And it does do wonders for those fibrocysts. And fibrocysts can increase your risk of breast cancer. So you do want to do something for it, and you definitely want to help the pain. Now, on the iodine, you got to make sure you don't overdo it. Yeah. Because on iodine, yes, it's great for the thyroid. But if you take too much, you can actually slow down the thyroid. A little really helps. So, we usually do iodine. We use one mostly. We have a couple different ones. We have a liquid one that's a really lower dose. If you do our liquid one, which is the iodine forte, we usually use about at least 10 drops a day, which is like 1.5 milligrams of iodine. We have one a little bit stronger, which is called triiodine, and it's 6.25 milligrams of iodine, but we'll usually only use it like 3 days a week if we use it. I have seen, there's some iodines out there that I've seen 12, 25 milligrams, and I have seen complete shutdown thyroid when some people take too much.
Yeah,
so definitely don't overdo the iodine, but iodine is very essential.
Yeah, you might think that that's just kind of an old wives' tale about shutting down the thyroid, but having been doing this for 28 years, we've seen a lot of people come in that had shut their thyroid down, taking way too much iodine. Yeah. So it's one of those things. If you're going to take iodine, take a small, what we call a therapeutic amount, but not too much to shut down that thyroid, because once you shut that thyroid down, it can be kind of touchy trying to get it back.
Right. Now, with, like I said, the fibrocystic breast, there's one other thing that's been known for years to help, and it does help. But if there's a question of doing it instead of the primrose, I would do the primrose by far. It's better, is vitamin E. And we do have a really good vitamin E called Eplex. And Eplex is all of your tocotrienols and tocopherols together. So it's really more like a vitamin E complex.
It is.
And one of those a day will do it. So if you want to add one little extra thing in there, I would do the Eplex. But I would definitely start with the primrose and the iodine because that makes a huge difference in fibrocystic breast. And you'll see pretty quick that pain will go away.
Now, we've got you thinking. We've got you something there to kind of get rid of that pain, ladies. And hopefully you'll take heed to it. In the meantime, take care of yourself, live healthy, and be healthy. And if you haven't already, hit that like button down there and subscribe so you can see the next video that's coming up. Thank you again, and live healthy and be healthy.